this issue of what is offered as a rule to most patients versus what is possible. The chasm between the two, that's what you're here, obviously, to help solve.
Right.
Yeah.
Yeah, so there's two problems. So one is standard care, which is pretty good. So if a patient, these are the guideline-based cares, that only works if they've actually even done standard care, meaning they've got the correct diagnosis,
Right.
and they've done the standard treatments and selection.
Right.
And shockingly, in America, there's a study looking at lung cancer with just standard diagnostics and treatment where every patient should have an EGFR mutation test. And it was found that less than half of them actually had that standard covered test. They didn't get it, and they didn't get the right treatment. This is standard. So even getting standard treatment, there's huge gaps. Never mind going beyond, say, wow, there are all of these innovative treatments. Now, there are barriers to that, saying that, centers may not be able to afford that, or they're not offering them. This is where patient empowerment comes in and say, wow, I could find another center that could do this, or I could do the test in my own hands. Like, for example, I'm dealing with a patient in Calgary who has a head and neck cancer, and they told me that they don't routinely do the molecular testing, so they can't match them to a therapy. However, if the patient did their own testing and found something, they could, but they're not allowed to do the testing on the public system.
Yeah.
So sometimes a patient could take matters into their own hands, arrange for that testing. Now they have to say, hey, look, I've got this. Now the oncologist can take action. So now that you have that, you actually qualify for this clinical trial that we have open. We can get you on it. So the testing is very, very important. Often it's forgotten about. The treatments can be quite expensive, but often they're covered by the government or by the pharma. The testing may not be. The testing is where you can really make a difference. And so, because if you don't have the test, you don't know the right therapy, and nobody's going to give it. But if you have that test and say, now I've sifted through 200 therapies, I know the 3 that are the ones that could work. Now you've got a case to say, I need that drug. People will listen to you because you've actually got that.
Yes, it's
that
easier
test.
to get a doctor on board with a prescription. It's easier to get some coverage. It's easier to get into a clinical trial or whatever it is. But it's true. Patients, essentially what you're saying, I think, is there's a lot more that can be done for cancer patients than is currently done in most facilities, even the best facilities.
Oh, yes, I'd say that only 20% of what can be done is being done. It's like that 20-80 rule. So they're really doing the minimum. It's not because, it's because it's overwhelming. Cancer is an overwhelming problem. The system's overloaded. There's, particularly in Canada, there's so many new population. The system hasn't been expanded. There's a lack of capability. We know in British Columbia that the BC Cancer Agency has to send patients to Washington for treatment because their facilities are overloaded.
Even for radiation, like basic therapies.
Basic standard therapies. The system's overloaded, and certainly getting these innovative therapies, they just don't have the capacity for that.
And they're not doing the testing.
And they're not doing the testing. They don't have the facilities. And in fact, sometimes they don't want to because we don't want to do this because now we're going to have to do this expensive therapy and all of these things. So there's many barriers that are systematic. However, a patient can overcome those. The system's not going to necessarily help you, but you can help yourself. And I found that patients that do the best are ones that have a partner that can really guide them through. At Protean, we're the partner. We can help, and also with your organization, you can help really guide a patient and their family. What are the choices? What can I do? And even if that doesn't work, at least you have peace of mind that you've covered all your bases and that you've really know what's going on and that you understand what's
I bet, as with what we discover when patients come to us for additional testing and navigation, it's exceptionally rare there isn't something better.
It's almost 100%.
It's
almost 100%. You will find something.
Yes.
Because there are so many, and like I say, there's probably 200 or more therapies. They're only considering 4 or 5 with standard, and they're just using like standard chemo or other things. Whereas if you get a targeted therapy, almost every tumor has a targeted therapy. You just have to look for it. It's like it's a bit like a needle in the haystack, but our new technology actually looks at every haystack and determines everything, is it a straw or a needle, and actually will find that needle. So it's not the technologies with NGS and comprehensive and ultra rapid detection actually blow away the haystack and you find the needles. So that's the whole idea of what we're doing.